For our next session, we are really so fortunate to have Dr. Dale Caldwell join us today, the Democratic nominee for Lieutenant Governor of New Jersey, representing the Cheryl Caldwell campaign. Dr. Caldwell is President of Centenary University and former Deputy Commissioner of the New Jersey Department of Community Affairs. He's also served his community for 26 years on the New Brunswick School Board and is pastor of Covenant United Methodist Church, guided by the principle from Proverbs 31, speak up for those who cannot speak up for themselves. Dr. Caldwell will share how the Cheryl Caldwell campaign plans to support working families in addressing New Jersey's healthcare affordability crisis. Please welcome Dr. Dale Caldwell.
Good afternoon, everyone. On behalf of Mikey, Cheryl, and I just want to thank you for the opportunity to speak here. And it's a very, very special time for me. As some of you may have heard, my dad marched arm in arm with Dr. Martin Luther King Jr. in Boston, a march to integrate the Boston public schools. He was in Selma. He was in the March on Washington. And my mom was a union teacher for 40 years in 5 different states. So I grew up around the importance of understanding labor unions, understanding the importance of remembering those who are struggling financially, understanding the issues around healthcare and small business. And so what you're talking about today is just so critically important. You know, as you know, this administration has an assault on New York, but an assault on New Jersey. And so some folks may not really understand what's going on. And so in New Jersey, we're losing $3.6 billion in Medicaid funding. $3.3 billion is being taken away from the hospitals. 350,000 people are losing their health insurance. 450,000 people, when ACA expires, are going to have their premiums probably doubled, at least and increased on average by $4,500. And this administration is putting a $5 billion hole into the New Jersey budget. So people ask, well, why are you jumping in at this time? But the reality is you can yell and scream from the sidelines, or you can kind of jump in and say, this is our time to make a change. And so Mikey and I look at this as an opportunity. It's an opportunity to really make sure that New Jerseyans get access to high-quality health care. It's an opportunity, and Mikey will appoint an attorney general who's going to fight this administration on the unconstitutional things that are denying people basic human rights, including the right to have health care, including the right to be healthy. You know, right now there are so many things that are happening that are just affecting, especially the middle class and those who are struggling financially. You know, among the things that need to be looked at is the state health benefits program, to have a third-party auditor begin to look at how that can be fair and more effective and more efficient. We want to really look at transparency and accountability. Mikey had talked about an agenda of transparency and accountability. You know, I have yet to find the person that exactly knows why healthcare costs are going up 20% every year. You know, and so we need to make sure and really hold people accountable to identify why is that happening, and more importantly, who's benefiting from that. So often that so many things are happening in the haze that we kind of accept and we deal with, yet we really need to begin to challenge that. The next attorney general that Mikey is going to appoint is going to look at some of the middle folks who are really jacking up prices, PBMs and other things that are taking advantage. You know, looking at everything from the pharmaceutical cost to really look at the healthcare cost and who's benefiting. You know, people need to understand why their healthcare prices are going up. They need to understand what's actually happening, and yet the amazing thing is that most people don't know. We want to expand access to preventive care as well, and some of the things we're looking at is mobile clinics and really creating some partnerships between health systems and schools. I was talking in the back to someone, as you heard, I used to be Deputy Commissioner of the Department of Community Affairs, and 2 things really frustrated me when I was there. One is that I said, well, why are we doing this? And I said, well, we've always done it that way. And so Mikey and I are coming in with clean eyes and clear eyes to say that doesn't make it. We need to understand times have changed, things have changed. We need to begin to do things that make sense right now. The other challenge in New Jersey, and it's true in New York and other states, is the silos that exist between departments. You know, I spent my career working in communities in Newark and Asbury Park and Camden and New Brunswick and others, really working with nonprofit groups and small businesses and others that are actually doing that. And the amazing thing is that government didn't talk to each other. So the Department of Health is not talking to the Department of Community Affairs, is not talking to Treasury, which is not talking to Education. Yet all of them are interacting with the same communities, and that impacts healthcare costs as well. So one of the things we're looking at is to begin to really look at how we can make, and sometimes when there's a crisis, when we're having assault from the Trump administration that our opponent is endorsing, gave an A to the sitting president, is endorsing exactly what's going on, this assault on New Jersey. When you start to look at this, there's an opportunity for us to really force change, and government needs to change. You know, Mikey has proven that she's willing to stand up to anyone, whether they're a Democrat or Republican, to do what's right for the people of New Jersey. And so when Mikey and I win, it's important to people know that communities win. When we win, it's important to know that those who are struggling financially win. When we win, it's important to know that small businesses win. When we win, it's important to know that all communities that have been overlooked win. And so I'm here just to really let you know that this is a critical time. You know, as you know, this assault across the nation, New York and New Jersey are getting more of it than anywhere else. Our race is being watched more than any other because they're really in Virginia. It doesn't seem, well, Trump didn't endorse that Republican candidate. And so if we're able to win by a comfortable margin, that begins to set up the stage for the midterms to really, you know, transition so that folks who are in charge, who actually care about middle-class people, who actually care about the poor, who actually care about people who are suffering. So it's important for us not to win by a little bit, but to go forward. And so I encourage those of you, and if you're not in New Jersey, you know people in New Jersey, to encourage them to come out. You know, one of the things that I've often said, when I was at Princeton, I was part of the group that fought the apartheid in Krugerrands, thousands of miles away, yet there's an assault in this country and people are being quiet because they're entertained by their phones. We've got to get people to wake up to realize that if we don't make a change now with healthcare and really everything, we are going to experience a real challenge for generations to come. And just finally, my mom who passed away this week from Alzheimer's, you know, research funding for Alzheimer's. I had prostate cancer. Research funding for cancer have been stopped. So my folk, and again, in the church we say you're preaching to the choir, but I really encourage each of you to preach to the people in your family who are apathetic. Preach to them to let them know that this is existential. So my hope is that you will get out, you will vote wherever you live, you will make your voice known, you will stand up for people who don't have a voice. And finally, my personal mission statement is Proverbs 31:8-9, which is to be a voice for the voiceless and speak up for the destitute. Those of us in the room care about those folks. You know, unfortunately, we have an administration that doesn't. So it's on us, the burden's on our shoulders to stand up for workers, for laborers, for folks who are barely surviving, folks who don't know where the next meal is coming from. So thank you for inviting me. You know, Mikey, Cheryl, and I are running not because we have to, but because we want to make a difference. So good luck, God bless, and thanks for this time.